Atrial fibrillation, two simple words. It's the most common arrhythmia we deal with in cardiology. This simple condition can be both debilitating and also life-threatening. We'll discuss that with you today. Welcome to Montgomery Heart Wellness Clinical Rounds, and today we're going to be discussing a case of a 70-year-old lady who came to our center because she was having symptoms of atrial fibrillation. Camille, you remember this patient? What can you tell our audience about her?
Yes, I remember her very well. So she was 70 years old. She had a history of prediabetes, hypertension, obesity, but also atrial fibrillation, supraventricular tachycardia, and anxiety. So a lot of times she would feel palpitations or an abnormal sensation in the beating of her heart, in her chest, and it was becoming more frequent, occurring at rest. Someone had given her anxiety medication, and those two kind of
we see that a lot. People getting prescribed anxiety medication when they feel anxious when having a cardiac condition. A couple of things you mentioned I think that are interesting. She had, other conditions, sleep apnea, obesity. I think she had high blood pressure. And so those are things that we think about with someone with atrial fibrillation, because the more of these additional conditions you have, the increased risk of stroke you may have. So that's something we consider. She also had some dizziness. So atrial fibrillation is a term many of you may have heard. It's when the upper chambers fibrillate. Sometimes people call it SVT, although SVT is generally a different class of arrhythmias, but it starts from the upper chamber, so technically you can call it that. But there are different variations of arrhythmias that can be seen and referred to as atrial fibrillation. From the general public standpoint, we tend to treat patients to control the heart rate. So she was having a condition where her heart was racing, so the fast heart rate was causing a problem. So she may need to get a medication to slow the heart rate down when she goes into atrial fibrillation. And the other medication we tend to prescribe is a blood thinner, as people refer to them as the anticoagulants, and that's to help prevent stroke, because individuals with atrial fibrillation are at increased risk for stroke. So the key thing to remember about atrial fibrillation is that you can have a fast heart rate that can put a lot of stress on the heart. And if you have that a lot, then the heart over time can weaken. So atrial fibrillation can predispose to congestive heart failure. That's number one. Number two, if you're having a lot of racing and irregularities in the heartbeat, it can form clots in the left atrium, more likely the left atrial appendage, a part of the left atrium where blood slushes around, and that could predispose to a blood clot going to the brain, causing a stroke. So those are the two big concerns we have with atrial fibrillation. Beyond that, it's just the symptoms. You're having the heart racing, and that's typically fairly easy to control in most people, but sometimes we have to do some extra things. But she was also having some dizziness, which you can't have with atrial fibrillation, but that makes us think of other things. We put a monitor on her, and what did you see on the monitor?
So we saw a lot of pauses, so going a period of time with no heartbeat, that more so can cause the dizziness.
That's right. That's exactly right. Now that creates an interesting problem, because if they have a fast heart rate, we can prescribe a medication to slow the heart rate down. But then if they're having a fast heart rate alternating with a slow heart rate, then if we give a medicine to slow it down, during the times when it's slow, it may get too slow. So it makes the management very tricky. And sometimes in these patients, we will give them a medication to slow the heart rate down, and we'll give them a pacemaker for the pauses. So she was in this situation where she was at risk for needing, more medications and perhaps a device. So she came to us to say, okay, is there something else I can do? And so that's where we went to work. Why don't we take a look at the tracings? And when we put the monitor on her, We saw here, you see these little irregularities here, and this, you can see definitive little small bumps. This spike here is an electrical signal in the lower chamber, but these small little bumps here, here, and here, electrical signals going through the upper chamber. And we see distinct bumps. So it may not be full atrial fibrillation. As an electrophysiologist, I may call this multifocal atrial tachycardia. I don't want to get into weeds, but there's a spectrum where when a heart fibrillates, you got 1,000 different places where electrical signals are starting, but sometimes you have maybe 5 different places. So we can count 5, you can't count 1,000 on the tracing very easily. So when we get 1,000, we just call it atrial fibrillation, even though there are multiple different areas. If there are 3 to 5, we can see them and say this multifocal. So really, multifocal and atrial fibrillation are kind of the same. It's just that multifocal has a few, atrial fibrillation has close to 1,000, and we just call it atrial fibrillation. But then you see here where you see this bump and you have a pause. That's not good. We go down and see some more tracings where we see this, more of these little fast beats, and you see a pause here. And then you go down and here's a longer pause. And this pause is somewhere around 5 seconds, okay? And so this kind of pause can cause someone to pass out. So this is what caused us to stop beta blocker, but she still had the fast heart rate. In fact, when you stop the beta blocker, she had more atrial fib and it was much faster. So we put her in the hospital. In the hospital, what did we do? Well, first and foremost, prior to her going to the hospital, she started a nutritional detox regimen. That's very important. Why is nutrition important? Well, we know in the medical literature, nutrition and exercise help control AFib really better than medications. So we can probably decrease the frequency of atrial fibrillation, maybe control it better if we get her nutrition right. We put her on a raw detox diet. We also started her on high dose vitamin C. We gave her IV infusions as well. And we also gave her ozone infusion. So she had started this at the very beginning of this treatment, but when we stopped the beta blocker, heart rate got out of hand. So we put her in the hospital, monitored her, made adjustments in the beta blocker, got it lower. Right. But while in the hospital, she stayed on the supplements and stayed on the diet and stayed on the magnesium. So that was working as well. So she came out, we continued these treatments, and what happened after that?
She was doing much better, so she wasn't having the dizziness because those pauses were really long, 5.8 seconds, and she wasn't having the tachyarrhythmias as much either. So y'all found really the right dose for her, and I think she needed less because of all these healthy things that she had put into practice that we had encouraged her to try.
Yes. So in this case, in summary, an excellent nutritional diet, the detox diet, it reduced the amount of inflammation. Because atrial fibrillation, what triggers atrial fibrillation? Underlying inflammation in the heart, scarring, so the heart's on fire, so it causes it to fibrillate. So you're on a raw detox diet, that puts that fire out. Increased oxidative stress, a lot of free radicals, chemicals, toxic chemicals that are flying around. When you stabilize these chemicals, again, it puts that arrhythmia under control. And then we give her magnesium. So all of these things help to put the arrhythmia under control. So instead of just prescribing a medication, maybe like amiodarone or something else, we prescribed a nutritional regimen with the metabolic enhancers. She got more ozone therapy, which enhances mitochondrial function, stabilizes cells. So if we look at the after effect, here you see the rhythm being normal, and she had a phone that recorded her rhythm, so she knew what was going on. So she saw less atrial fibrillation. Eventually, she went into persistent sinus rhythm. Here is a 12 lead EKG. So she went from having frequent episodes like this to going to episodes like this when her heart was under much better control. So, and this happened in a period of about 4 to 5 weeks. Now, we're not finished. There's more work to be done. She's going back home. She flew into Houston from Connecticut, but she'll be going back home, and we'll continue this regimen with the supplements as well as the nutritional regimen. She's on a very, very tiny dose of the beta blocker, and the beta blocker does not convert to sinus rhythm. Right. She was on a much lower dose than what she was on before, and we've almost weaned her completely off of that. So we look forward to seeing and hearing great things from this patient, and we'll keep you posted. So I hope you got a lot of information from this. And of course, as always, any questions or comments, leave them in the comment section, and we will try to address them as soon as we can. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see